Welcome to America's Healer with Dr. Jason West. Dr. West and his guest experts are about to open your eyes to a whole new perspective on the medical world. Now, here is your host, world-renowned Dr. Jason West.
Hey everyone, I am so excited about our program. It's recovery from COVID and other chronic viral infections. And most importantly, I'm so excited to have my first guest on the program, a really good friend of mine, someone I work with every day, an awesome healer, the world's greatest nurse practitioner. That's what I always tease her and say about, but I actually mean it because Shelby not only takes care of me, but I've seen her do miracles on other patients. And so we wanted to put together a program because so many people are asking us, what would you do for, chronic infection? What do you do for the cold? What are you going to do for the flu? What do you do for Epstein-Barr? And of course, what we do for COVID and recovery from COVID, it's kind of the same in the office. And so that's the segment that we're doing. I'm just delighted to have a guest. A couple things I wanted to talk about. One, I wanted to give a special shout out or special recognition to our sponsor, which is the West Clinic, which is where Shelby and I both work every day, and our amazing team over there, that our support structure. We work with a 2-time Doctor of the Year award winner in Dr. Nelson. And then we have an amazing team leader and doctor assistants and front desk and virtual assistants and video assistant, everybody that's part of it to make the healing process happen. So that's our program, recovery from COVID and other chronic viral infections. And what we really wanted to highlight is some of the things that we can do to help people recover from chronic infection, what it causes. And there's really about 5 or 6 different secrets that we have. And so I wanted, again, to be very aware of a gifted healer that we have with us, Shelby. So Shelby, let's talk just a little bit about, before we get into infection, I think everybody needs to know a little bit about your background and your pathway. So you've been in healthcare about the same as me, 20 plus years.
Right. About 25, 30 years.
Okay. And you started off in the nursing pathway. So just kind of walk us through what that looked like and then how you transitioned to a nurse practitioner, which obviously you have more things that you can offer people. And then, and we'll kind of talk about how our paths way across, but you started off in nursing and how did you start that pathway?
So 1993, I started as a nursing assistant.
Okay.
Taking care of people in nursing home. And so I did that for a while and I thought, well, I need to do something different because this isn't what I want to do for the rest of my life as far as that particular skill.
Okay.
So then I went and I went to be a licensed nurse practitioner or licensed nurse, LPN. And then I went and did associate's RN, bachelor's RN, and then master's RN when I moved here to Idaho. And in 2000, I moved here in 2002, but then I did that in 2010. And just sort of been in nursing the whole time, worked in vast areas of nursing. And then here we are.
Right. And so,
in a nutshell.
So you kind of had that traditional pathway.
Yes.
And then you started being aware and started saying, wait, I want to incorporate more things. So I know there was a lot of energy and mind body stuff that you started being aware of, but what got you into the integrative space? Before we merged, you were pretty open-minded. So how did that happen?
Well, really, I think it was the patients that I saw, especially up in Island when I was in Island Park and doing rural medicine. They would come in for their primary medical care, but then they would have all these other things that they were taking, supplements and herbs and all that. And a lot of them were from Montana, and they would come in and I'd be like, what is this?
Right. Because if it's not medicine, it doesn't work. Right. Or at least that's how a lot of people were taught.
Right.
And so you're like, well, they're taking this. And then where does that lead you?
Then that leads me to think, why am I always prescribing something medication wise for these symptoms that people come in for? Because you give them medicine, they have symptoms, they may get better for a bit, but then they sort of come back and it's the same thing. And then they have these other problems and other problems and other problems. And so I just really was intrigued at that point on what else I could do to help patients.
And so you went from the rural medicine at Island Park, which for people that are listening, that's about 2 hours north of us, right on the Idaho-Montana border. A lot of tourists, a lot of snowmobile stuff in the wintertime. And then you ended up in Pocatello, and I think you were looking for a place to land. And we connected through Facebook? Was it a Facebook ad or something, or a patient? I can't remember.
You put an ad on Facebook, I think, that you wanted a nurse practitioner or a physician assistant. And my friend, Erica, is the one who told me about it. She goes, I know you like this kind of stuff. You guys might connect. You might like that stuff.
And I think that was like February 2015, right?
Yes. Well, actually, was it 15? 14?
Maybe
15.
It was 14.
It was 15.
Okay.
Yeah, it was 15.
So we're coming up on 8 years.
Right.
And I remember, so this was kind of a fun thing for me and again, everybody, we're talking about, recovery from infections. We're just laying the groundwork just a little bit. But when we first started together, I thought, okay, I want to expose you or educate you to the things that are in my world. I recognize that you have a fantastic education in the traditional medicine. And I thought, it's probably going to take a year to put it together. And I remember after, literally it was like 2 weeks or something, you were like, hey, I got this. Like I need to, which was really cool. But you've done an amazing job of merging worlds together. Like I've seen you're very gifted in, herbs and nutrients. And we're going to talk about how that goes into infection. But you're also, when needed, it's like, hey, here's a thyroid medication, or here's a blood pressure medication, or things like that. So walk us through a little bit about when the traditional world hits the integrative world, that created just more education and awareness. And you've done an amazing job merging it. How did you merge it?
I think I merged it with with experience. I mean, I had a lot of experience with critical care and people that have been sick for a long time, short time, emergency medicine. And so I feel like I just really had that experience all those years prior to is what helped me be able to navigate what we can do, on the natural side. And then also when we need to, use medicines or use emergency services too. So I don't know if there's an actual specific thing or pathway. I just think it was everything that I've done and that we've done together, and you've showed me, and I've learned and gone to all the different seminars that we've gone to and got certifications. I don't feel like I would have been able to do that without that also either. So I think it was just being open and learning and being willing to take that leap and putting the effort in.
And I know when I knew that you had, quote, arrived, when I came down the hall, and so our offices are in the back part of the office, and I came down the hall and I was, busy. I was trying to keep up. And I think one of the patients had told me, my thyroid's off, and maybe I just got a little busy, or I wasn't into it as much as I should. I'm kind of embarrassed to say that, but I came back and I'm like, hey, Shelby, there's a patient in West Point, which is one of our rooms, and they're having some thyroid problems. Would you go do workup? And they're probably going to need some thyroid medicine. And you're like, oh, wait a minute. They need, this organ building thing, and they need amino acids, and then they need some iodine. And it was like repeating back to what I usually tell people. And I was like, oh yeah, all of that. And then I knew okay, this is perfect. Like you really got it because you were willing to look at both things, but you were kind of reminding me too that, well, we just don't immediately jump to prescriptions. Like we're not opposed to it, but usually,
right.
And so that's one of my favorite memories of you is you're going, well, wait a minute, I'll take it from. So like getting into our topic. So you've had a merging of traditional to alternative or functional medicine. We have the speed side. We talk all the time about patients and stuff like that. I think that's one of the reasons why we get such good outcomes, because neither one of us cares who gets the credit. We just want people to get better. And so I'm like, hey, Shelby, let's be consistent or congruent on this. And what do you think of that? And so I've learned a ton from you by just saying, hey, what do you think of this blood test and that blood test? And one of the radio requests we got to talk about, infections. And of course, when I first started in my pathway, I was thinking, when someone has an infection, you try and put the body back together. Why did it happen? And then put the building blocks back together. And then you use liquid vitamin C, and you use LDM and myosotis and echinacea, all these vial tasting things. Like I grew up that way. So when I got into school, and our school was like, okay, we do a lot of musculoskeletal stuff. And by the way, if someone has an infection, you refer them out for antibiotic. And and so coming in and recognizing that infections, there's so many factors that are involved in a chronic infection. But I would like to you to just talk a little bit about your perspective on infections since we've been working together in this merge space, because I've seen you turn around some amazing stuff. And it's not always an antibiotic or antiviral.
No, it's not. And I think we have a unique thing because we can do, if we need to do antibiotics, we can, but we really use a lot of oxygen therapy. So oxidative O3 medicine. You say ozone, people sort of get like, oh my gosh.
Well, it's because everybody thinks the ozone layer
Right.
is polluting, but ozone is basically, we use it in a sense that we want to create an extra oxygen molecule that speeds up healing. But you're right, and I refer it to oxidative medicine. But that being said, did you have any experience with ozone before our paths merged?
No, just knew about it in the air.
Okay, so we know about it in the air. And then, so what was your first thought when I said, hey, we're going to take someone, we're going to like pull some blood out, we're going to mix it with this oxygen ozone mixture and put it back in. And again, you can be as honest as you want. What was your response?
I'm like, what
like
the bleep is going on?
So
honestly,
for the listeners out there, she'll be probably not the best poker player because her face tells exactly how she was feeling. But so I learned that from Dr. Schallenberger and the German medicine and Dr. Bochi and Dr. Robbins and Dr. Taylor, like all these guys that I'd studied with. But give a perspective on some outcomes that you've seen, tell us about some of the infections that you've seen and what happens when you use oxidative medicine and vitamin C and supplements and stuff like that.
Well, I just when I had that mindset first, and it's like you get into this mode where, okay, I want to learn everything I can about it. So that's when I did. You sent me to seminars. I read all the time, and so then it's like, okay, so we're using small gamma, we're getting it pure. It can't be that harmful. I mean, you've been doing it for how long? Not only you, but all these other people. So that's when I was like, okay, I'm going to embrace this. And so I think one of the first huge cases that we did integrated medicine was with a spider bite.
I was going to tell everybody, hey, you guys, Shelby actually literally saved a leg from amputation. Right. That's what she's talking about. And it's just such a cool story. I don't want to steal it. Keep going.
Right. And so, patient came in after a few days she was gardening and then got this redness and swelling in her leg. And then it just ran rapid, like within, several days. It was horrible. So she did get some antibiotics initially, but then she went back to her primary care and they weren't going to give her any more antibiotics. They were going to send her to wound therapy, but then she came to the clinic because she's come to you before. And that's when we started to use oxidative therapy called limb bagging, where we do the ozone, wrap the leg with the bag and then infuse ozone on the outside of the leg, and then also doing injections into the area too. But then also using antibiotics long-term to kind of keep that infection down as well. So they told her she was going to lose her leg at physical therapy.
Well, it was pretty nasty. I mean, we've seen pictures like
there was
cellulitis and there was weeping and
huge swelling, and
it looked like kind of a
it was getting black and purple, and blood flow was low, and her toes were starting to get vascular changes. And so we did her treatments every day for 2 weeks?
Yeah,
maybe longer than that. So
I think it was 2 weeks initially, and then then we moved it to once or twice a week after that,
and she was antibiotics daily for a month, and then after that we sort of weaned them down. But within days, you could see huge improvements, limb bagging, doing the ozone to her feet, and then also doing the IV therapy too. We did a lot of vitamin C, minerals, did some manganese for that cellular healing, and she was on supplements too to help her immune system be able, and her liver and her detox organs and gut to be able to process all that stuff. So
yeah, and you guys, we have the whole story up on our our YouTube channel where Shelby interviews Joanne, and it's really a special event. And I'm not trying to say that it's a one-off, because we've done this lots of times.
Right. No, this isn't just one time. It's just one of those stories that sort of sticks out because it's one of my first as far as really, truly having integrative medicine, like melding two worlds together.
Yeah, and I saw you do. I got a first line just observation of you taking someone that was like, so just, oh my gosh, they're going to cut my leg off, to hey, I might have hope that I can keep it, to oh my gosh, I kept it. And then like every time she comes in, you guys have this, special bond because she's walking now.
Yeah, we surely do. And that's one of the nice things too, is like the way we practice, we get our patients become our family. I mean, we connect more with others than we do some, but with Joanne, like I feel like she's my family.
Yeah, it's a special story. And when we do that, you guys, we're getting ready to head into our break. We are on America's Healer Radio, sponsored by the West Clinic. I've got a special guest inside of our studio, the world's greatest nurse practitioner. WGNP is what I call her. Shelby's been with me for 8 years, and we're talking about melding of worlds. After the break, we're going to be talking about things specifically that we wish people knew about chronic infection. So healing up from Epstein-Barr and cytomegalovirus and parvovirus and COVID virus and the flu virus. Like, a virus is a virus. And if we put the body back in balance, we see really good outcomes. We're going to be talking about what those are, neural therapy, infusion therapy, oxidative medicine. And so we're really excited about our next upcoming segment. And the Dr. Jason West, Shelby Stoddard, a nurse practitioner, in studio talking about chronic infections. And as soon as we get back from the break, we're going to be talking about the
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, you guys, we are talking about chronic infections, recovery from COVID. We're also going to be touching on Epstein-Barr and cytomegalovirus and what viruses do to the body. I'm so excited to be joined in studio with one of my healthcare heroes. And so I see a front row seat of Shelby literally healing people every day. It's really fun. She's helped me personally. She's my Zen master that talks about how we incorporate mind-body healing. And we've got a request to talk about chronic infections and specifically how to recover from COVID. So the next two segments, we're going to be kind of unpeeling that and going through that. The first segment, we talked about Shelby's journey through healthcare, starting off as a nurse assistant and then an LPN and then a nurse, and then going into a nurse practitioner program during some rural medicine, and then how our paths crossed and how she's been able to meld traditional medicine and integrative or alternative medicine together for the patient's sweet spot. We also got to talk about saving Joanne's foot from amputation. That was about 5 years ago, probably.
No, well, that was probably 7 years ago.
Okay, so 7 years ago, she had a spider bite that turned into this horrible infection, and she got cellulitis, and it just looked horrible. And Shelby used a combination of oxidative medicine, of vitamin infusion treatments, and antibiotics, and some other things. And so one of the things that I was able to make Shelby aware of when we started the office, or started working together, was chronic infection, whether it's bacterial or viral, leads to a whole bunch of different problems. So we use a paper in the office that was published in the British Journal of Medical Practitioners that says that viral infections and chronic bacterial infections, so both kinds, lead to neurodegenerative, neurobehavior, psychiatric, autoimmune, and fatiguing illness, which means it attacks the nervous system. The nerves start to degenerate. Then they don't behave right. Then it can get into your mind and your brain, and depression, anxiety, cyclic moods disorders, neurotransmitter imbalances. It mimics a lot of autoimmune disorders. And so this is why I really like whenever patients do a workup, like if you came in the office and you said, we have an acute flu, or we have a chronic infection, Epstein-Barr, that's causing mononucleosis and being tired, or you said, I'm trying to recover from COVID, or having an accidental reaction to, the COVID-19 medical procedure, the vaccine, and I'm putting air quotes because that's a whole nother topic of it. Is that really even a vaccine? But I'll save that for a little bit later. But if someone was trying to recover from that, I'm going to ask Shelby, like a lot of the treatments that we do are similar because we're trying to put the body in balance. And so when I talk about putting the body in balance, like just walk people through how we do that. Because I love how you do your workups and how you start working with people that are off balance. So if someone came in and said, I'm sick, how do you start putting them back together?
When they first come in, they fill out some paperwork. It's not little, it's a lot different than what you fill out when you go to, your traditional primary care doctor. We're looking at nutrient deficits. So there's quite a few questions that I'll ask about mood and your bowel functions and what you take in, and they're categorized by systems. So liver, bowel, or GI system, brain, all those things. And so anyway, you come in and you fill that out, and then we put that into a computer program, and it gives us a percentage of what organ might be stressed, or not might be, but what is stressed based on what you're filling out and symptom wise.
Yeah, I call it a nutritional report card. Like it just kind of gives you awareness of, is your liver off, is your stomach off? And again, like our program's talking about infections, but what we've talked about a lot together is the reason why people get infections is because something gets off, right? One of the organ systems gets off. So, so you take this information and you look at it, and then what do you do?
Well, then we pair that with, we do a medical microscopy. So we're looking at what the cells are doing in this moment. So what do they look like? Are they stacked all together? Are they spread out? What's of them? What else is floating around? What's around in the background that could be alluding to why why you have infection, why you feel the way you do? Is it more viral? Is it more bacterial? Indicators. And so it really helps us decide what tests we're going to order, what supplements we might use, what IV we're going to start with.
And we also couple that with blood tests.
Right.
And so as we started working together on blood tests, like you were trained to look at the blood tests of, okay, if it's over here, it means this disease. If it's really low, it means this disease. But we also put our minds together saying, like, if we have some deviations from that. So I'm wondering if you could share with people, like, what you are picking up or seeing in blood tests that you didn't really see in your traditional medical training.
So in many blood tests, there's a wide range. So what's normal, low normal, what's high normal, and there's all this other stuff in between. So learning really what is optimal for people. So, if their thyroid test is at 4 and, normal is anywhere from 0.02 or whatever it is. This depends on what lab, to like 3 something or 4. And it was at 5. You say your TSH is at 5. Well, sometimes you don't treat in medical world, but in our world, we want it 2 or less.
Right. We want to be like, okay, wait a minute. This is deviating off.
Yeah.
Let's get it back.
And so, but also like with infections. So we're looking infections specifically, we'll look at antibodies. So if we're looking at like IgM antibodies or IgG antibodies, and IgG antibodies are more for past infections. So meaning that you've been exposed to a certain virus. And then IgM is more of your first line antibody that will come up if you have a more recent or acute, what they call acute infection. So we'll look at that. We look at your liver function, kidney function. We'll look how your body is able to process vitamin C. We'll look at vitamin D levels. We'll look at all of these different blood tests number-wise to compare to the nutrition survey, to the microscope findings, symptom findings, to get you the best protocol or best treatment plan to help you build and repair and recover.
And I think this is what we are really different from other clinics on, because when you come in and you have an infection, yes, we want to help your immune system. Yes, we want to work on, the forgotten glands in medicine, which are the thymus and the spleen. But also every plan's a little bit different because people need different things.
Right.
And if I was to ask you or to say, Shelby, tell me about your observation of the power of the right nutrients. Because when we first started, you're like, yeah, I know a little bit about nutrients. And I think you knew a lot more than most people. But tell me about the power of nutrients.
Power of nutrients is, I think, everything. And not everybody is the same. And knowing how to navigate each person and what they need is what we do best, especially with the three of us working together. So we all have a little different experience. And so when you have the right nutrients, your body can heal and recover. If you're just taking stuff that your body doesn't need, it can cause issues. It can make things worse. And so finding that nutrients is power. It's healing.
So the nutrients, like an example of this is the nutrients have the power to heal, but they also have the power to do bad things. Mm-hmm. Like, for example, I think that taking the wrong kind of calcium contributes to stiff arteries or arterial sclerosis. Like the wrong calcium is bad for you. The right calcium, is life-changing.
Oh gosh, that's such a huge thing that I learned coming to the clinic too. It's like, wait a minute, you just don't eat up Tums to heal the body.
That is true.
So it's just, we learn nutrition in the medical world, but it's so not the focus. It really isn't. And then too, looking back at old nutrition books that I've learned basis what we do now. I mean, some of that's in there, but that's not the points that are brought out in what we learn. So I feel like I'm just so blessed to be able to know all of these things.
Yeah. And you guys, Shelby's like literally encyclopedia. Like I would tell her, hey, you should do this for thyroid, or you should do this for the spleen. And we're going to talk about how that helps with chronic infections. And she would be like, well, I need more information than you just telling me. Like, okay, well, here's the book, or here's the study, or here's the event. So what we're talking about is recovery from infections. And so Shelby, before we get into the next break, so I want to make sure that in the next part of our radio program, we can cover this. But there are some pretty incredible breakthroughs that people need to know about for infection. So if you have chronic tonsil problems, if you have, COVID, if you've got Epstein-Barr, a lot of the denominators are the same as let's make the internal environment healthy. Let's upregulate that. And so let's just start talking about some of the things that we really like to help people with chronic infection inside of the office. In the last segment, we're going to be specifically talking about how to help heal from some of the damage of chronic infections, whether it's COVID-19 or Epstein-Barr and some other stuff. So you guys, we'll get into that. But to set up the baseline of some of the things that you like to use in the office. If I walked in and I said, oh, I'm dealing with this Epstein-Barr virus that I've had off and on since college, and I don't want to go to bed for a year. Tell me some of your tools that you would use to treat me for that.
So after we would get that workup, we have that information. We would do IV therapy. I would really suggest we do IV therapy, because IV therapy bypasses the gut and gets right into your system and gives you that energy to be able to feel better, to be able to want to do supplements, be able to want to do these things outside the office. So you got to heal from the inside out. And
Shelby, with that, when people think IV therapy, sometimes they're like, oh yeah, I've had that. I wasn't feeling very good, or I've seen The Hangover bus in Las Vegas, and I went up and I got some IV therapy and they gave me saline. How is saline going to help me? And that is not what we do. So Tell people kind of some high level things. What's in some of that IV treatments that help so much for infections?
Well, number one is vitamin C. And vitamin C, not just, 150 milligrams. We do high dose vitamin C. So 25 grams of vitamin C. And so to get that cellular and physiological change, you got to use high doses. So you're changing that gradient across your cells, so you can actually get out what's in the cell. Because the medical microscopy, we see a lot of various things in the cell. We got to get that out, and then give your cell the nutrients it needs to be able to heal and repair from there. So
And
you're
then-
also detoxing, but also giving it some good nutrients to be able to do it.
And Shelby, when we talk about vitamin C, the
Mhm.
RDA levels are 500 milligrams. You should get it from eating an orange or an apple or kiwi, or, we're from Idaho. There's a lot of vitamin C in potatoes, but we're talking more than that. So when I first said to you, hey, let's give this, dose of 25,000 milligrams of vitamin C, what did you think when I said that?
I was like, well, that's not recommended.
And then
I had to research.
Right. And then when we found out, well, actually that's kind of a mild dose.
It is.
Well,
And
we can go
use
way
more.
higher than that.
We can. And then to me seeing like we have 30 to 50, 60 patients sometimes come through our office every day. They get this dose of these vitamin C infusions and they're fine. As far as adverse effects, they're not falling over.
Right.
Their vital signs are fine.
Well,
we're making change.
I've had doctors say you can't give, that type of vitamin C and minerals. And I'm like, yeah, but the patients get so much better. Like you've seen fibromyalgia, you've seen rheumatoid arthritis, infections. We've had some really neat cancer support therapies and people responding from these quote untreatable autoimmune conditions. And so we have vitamin C in there. What else is in there?
We have minerals. So minerals like manganese and some copper, small doses, zinc, magnesium, calcium, potassium.
So we want people
Fluoride.
to, like, when we do the workup, we do the nutritional evaluation, we're looking at their blood tests, we're doing a medical research project in the office with medical microscopy and trying to get everything balanced. And then we move on to, and this is what people want to know that we have, and this is what we're trying to cover in the 3 minutes before the break. But Shelby, you're really good at glandular therapy and protomorphogen therapy and giving the body these building blocks. So can you just touch really briefly on like, how can we help the immune system with some of these organ glandular products?
So this is something too that I've learned since I've come to the clinic is that you got to give your body what it needs to build and repair. And so protomorphogen therapy is giving an extract of whatever organ it is that we're trying to heal. That's what protomorphogen means. You're giving kind of like to be able to heal. That's more like homeopathy. And so a protomorphogen is again the extract, and then you're giving the nutrients to also sustain that healing process even further.
And what have you seen when you start doing these organ extracts? Specifically, like, we love treating the spleen. We like the thymus because it helps the white blood cells to differentiate.
We see people get better.
Yes, and that's the key thing. Like, I just love it when, especially with Epstein-Barr, and we're going to be talking in the next segment of what we can do to help people that have been damaged by an infection. Like, I think there's, like, particularly with COVID, it bothers the lungs. It it can cause scar tissue in different places. So the Epstein-Barr can get and cause fibromyalgia type symptoms. And I think that there's infections that get on top of the nerves. But this organ therapy is like a blueprint. Like, it just tells the body, you get these nucleic acids and these little specific signaling molecules that say to the body, okay, we need to work on the liver, and we need to fix the kidney, and we need to work on the spleen. And then what happens is we kind of need to get out of the way a little bit, but we're also not forgetting the other stuff. So we've got like 2 minutes left. Shelby, tell people kind of a little bit about your experience with vitamin D and vitamin A, some of the stuff that you prescribe that are really good for just about all infections. What else are you using?
Well, vitamin D for sure. Especially here where we live, so far away from the equator, we are vitamin D deficient. And so we need to get those levels up. And sometimes we have to use injections. Sometimes we have to use quite a bit of oral therapy. But getting the vitamin D up past 50, I've seen it, it really helps aches, pains, helps your body be able to fight infection. It also keeps infection from getting very severe, especially seeing that with COVID. So.
All right, you guys, we're getting ready to go into a little bit of a break. What we've been talking about is the recovery from COVID and other chronic viral infections. I'm Dr. Jason West with our guest inside the studio, Shelby Stoddard, who's a gifted nurse practitioner. So we're going to give a little bit of a break. When we come back, we're going to be talking about how we put the body back together, specifically from these infections that target different organ systems.
Network. You're listening to Voice America Health and Wellness.
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, you guys, we are covering how to put people back in balance. We started talking about our guest inside the studio, Shelby Stoddard. We've been working together for the past 8 years of her journey from traditional medicine and nursing into advanced nurse practitioner program, how she melds healing processes together. She saved a leg from amputation. That's just one of many. We started talking about how we can put people back together by literally figuring out where they're imbalanced and putting the balances back in place. We got a request for the program to specifically talk about recovery from chronic infections, and specifically the COVID-19, the long haulers, how it damages the lungs and decreases vitality and the brain fog and everything. So we're going to for sure be touching on that. We also wanted to tell people, like, everybody's a little bit different. There's not a specific protocol for a specific condition. The way that you help people is you try and get balanced people back in balance, like the imbalances to balances. I had a really fun workup earlier this week where a patient had traveled from a long distance to the office. And I said, what made you decide to come here? And she said, well, I've seen what you guys put on Facebook and what you guys put up on YouTube. And she said, when I first saw it, I thought, man, and this was her statement that kind of made me chuckle. She's like, it'd almost be arrogant, except that it's true. Like, you tell people that you're going to help them. And then I've seen hundreds and hundreds of testimonials. And so we invite you guys to check that out. If you'd like to see proof in the pudding, pick us up on Facebook or see our blog on westcliniconline.com. But what we really want to do is to figure out how we can help people across the street or across the country. And I promised one of our listeners, I'm specifically going to talk about COVID recovery. So Doug, this is a shout out for you about that. And Shelby, when we see people that are struggling from this virus that caused the pandemic, and they have a lot of times it gets into their lungs and their energy levels are really off. The brain fog's not working very well. We want to, again, put everybody back in place, but you have a couple really cool tools. And so one of them is an oxygen transporter. One of them is how we can help lung tissue. And this is on top of, doing all of our work and telling people that you've got to do mind-body healing and the biology of belief, and we can't give up hope. Like, that's so important part of our protocol. Right. But this really cool that we have a lung tissue extract that I'd like you to talk about, and then tell people a little bit about this oxygen transporter, because this is how we rehabilitate lungs. So tell us a little bit about this and what it does.
So the lung tissue rebuilder, it's called, am I allowed to say names?
Yeah, let's say it.
So it's called pneumotrophin PMG, and that just is, it stands for lungs. And what it does, it builds and repairs the lungs. So you are giving lung extract, so from porcine or bovine, depending on the source, and it's small doses, and you're giving the lung what it needs to build and repair.
So when I first told you about this, hey, Shelby, in our office, I believe that we can rebuild organs. Mm-hmm. And you looked at me with that poker face and was like, wait a minute. That is what? Not the accepted medical education or training, but I've seen you do this. Like, I've seen you help turn around livers and kidneys and lungs. And so I tell people, look, it's ground up bovine cow tissue. And we have these little things in here, this protomorphogens really tell the body how to repair itself. And we've seen some good outcomes with this, with people that are, hey, my lungs have been really damaged. Well, in medicine, they don't really have a way to rebuild lungs. Is that fair to say?
Right. We don't. And so you're giving people steroids to knock down inflammation or irritation in the lungs, or you're giving breathing treatments, with stimulants that people don't feel good afterwards. Their blood pressure goes up, their heart rate goes up. I mean, it opens up their lung airways, but it just doesn't, it does the job for the symptom in the moment, but it's not answering the why.
So
why is it happening?
So if someone came in and said, look, I had, COVID 6 months ago or a year ago or 2 years ago, and I haven't really felt the same, we would be like, okay, let's do a history. Let's try and figure out what is wrong. Let's do the blood tests and make sure we balance this out. Let's look at your blood, see if we can figure out why it's not responding. Because if we get the blood healthy, then we get you healthy. Then we add this pneumotrophin. But there's also another thing that really helps the body to carry oxygen, so that we're trying to build the cells. And so tell us a little bit about this oxygen transporter.
So this oxygen transporter is what we call cataplex E2. So E2, that's the where the heart, it gives the heart and the lungs, the muscles, the oxygen that it needs, and it gives it the building blocks to be able to have all of those reactions that you need for cellular energy so your body can actually breathe and respirate and get the oxygen in it needs to build and repair and to actually function. So it's, it protects, it's hard to say, but maybe a phospholipid. So it helps protect the cells and then increase oxygenation. So it allows that oxygen transport across the cell.
And what we always talk about is, if your cells are healthy, you're healthy. And it's kind of fun. When we started working together, I was telling you, hey, there's some vitamins that you haven't heard about. And you're like, well, I'm pretty sure I've heard about everything. I may not know what they do, but I've heard all of them. And I'm like, well, what about vitamin E2? And what about vitamin F and vitamin P and vitamin G and vitamin T? And you're like, wait a minute, those aren't real vitamins. I'm like, well, maybe you just haven't been exposed to those. But vitamin E2, it's a B phospholipid extract that helps to protect the membrane of the cells and carry oxygen. And again, if people are on oxygen, like, great, I don't have any issues with that. Let's just make your blood so that carries oxygen. And then the other thing that is such an important part, and this is what Shelby is so good at, is there is a tendency for the body to develop nerve memory. And I really wanted to make sure that we covered this, particularly in the cases when people have been chronically ill, because your mind tells you, oh, I want to live my life at the highest level. I really want to thrive. And then death's at the bottom of the scale. And then what happens for a lot of people is they just kind of survive. Like their nervous system thinks, oh, what's happened is I've been sick for a while, or I've had this COVID exposure or this other viral exposure. I've been sick for a long time. And the nervous system think that is to be normal. Correct. And so then what we want to do is like, okay, how do we wake that up? And so I was excited to make you aware of neurotherapy. You've taken it to this wonderful, amazing heights. But I want you to talk, why is neurotherapy so important, especially in the infection world? Like, that's question one. Question two would be like, how do we use it to help the lungs? And then I would love to, I'm excited to hear what you tell me about neurotherapy, because I love it, but you're super good at it.
Thank you. Neurotherapy. So we're looking at symptoms. And so the nervous system holds memory, like you say, and then those memories eventually lead to symptom. And so there's different circuits in the body that respond to each other and kind of have these feedback mechanisms. And so when those get altered, that interference or that electricity is changed as well. So that's one of the things we don't remember sometimes in medicine, is that we're made of energy and electricity. And so we need to change that too. And so that's one of these, this is a therapy that I've just grown to love, because you've seen so many amazing changes, because when you change the circuit, you change the symptom.
And it's fascinating to me as well, going through an undergrad in microbiology, going through a musculoskeletal, really heavy program in Southern California, where it was just all about biomechanics, and it was about biochemistry, and it was about hormones. And then the longer that I'm in practice, the more I recognize, well, it's really about energy. Like, energy is what makes everything work. Like our vitamin C treatments, the reason why we believe in those so much and we see such good outcomes is because vitamin C donates energy to the body. It donates electrons. And so when you're changing these energy fields, we just see these amazing changes. So there's a specific treatment that helps with lungs to recover that I was hoping you'd touch on. It's the lung neural therapy. So why would you use it? And then how is it done inside the office? And kind of what are some of the outcomes you've seen?
So this is the neurotherapy then we do specifically over the lung fields. And so what we're doing is, again, we're trying to break up the circuit that's not firing or causing or stimulating a correct response in the body. And so, the goal is to decrease or eliminate the stimulus. And then you're going to, disseminate the irritation so you can promote healing. So we do injections right under the skin. We use a solution called Procaine, which is an old anesthetic that breaks down the parabenzoamino acid, and that stimulates the nervous system to get out of that vegetative state, kind of wakens it up, if you will. And so then when you waken it up, you're changing that cell, and from the cell to the messenger to the next cell, you've got these circuits. So you're changing the circuit. So you're changing everything from the skin to the organ.
And I like to tell people, like, if your body was a computer and it started being dysfunctional, you call up tech support. Tech support's going to say, turn everything off and turn it back on. And that's what Shelby and Dr. Nelson, what we can do inside of the office. So there's a protocol of getting your central and your peripheral nervous system together. There's one for your heart. There's one for your lungs. There's one for your stomach. There's one for the nerves going down your leg and the nerves going down your arm. And there's one for the skin and the immune system. And then, Shelby, I saw in your notes, because you have done a great job in preparing, there's another thing that we can do specifically for COVID long haul and lungs is the stuff called DMSO.
Yes. So DMSO is a solvent, and you've had a lot of experience with that. You brought that to my attention. So how would you explain that?
So DMSO stands for dimethyl sulfur oxide. It's a universal solvent. It basically comes from tree sap, but what it does is it helps to break up hardened tissue. And so using that in part of our treatment program, it's we get the body to be healthy. We want to make the cells healthy. We want to reprogram the nerves, the circuit thing that Shelby was talking about, and we want to soften some things up. And that's a part of our infusion treatments. A lot of people recognize DMSO for treating horses and some other things. And so as we start ready to wrap up our program on what we can do for chronic infection and COVID and Epstein-Barr and some other things, Shelby, in the last minute that we have, what would you recommend to people, or what would you say so that they could do stuff to be healthier?
I would say, don't let your symptoms become your identity, and get help. Come to the clinic or a clinic that's similar that can help you find your nutrition deficit and, get work on that. So, it's definitely in your best interest to get help sooner than later, and not just be like, this is my way of life. There's alternatives to healing, and there's so much you can do to help yourself feel better.
So you guys, that's really our show segment for this week. It is Dr. Jason West, America Healer program with our special guest, Shelby. We also wanted to tell people, like, you can get help. You're not your disease or your diagnosis. A lot of the things that we've talked about, it's available on our website, americashealer.com. Next week, I'm so excited to bring a 2-time Doctor of the Year award winner, Dr. Scott Nelson, into the studio. And we're going to be talking about energy and acupuncture, and how, if you have an imbalance of these energies, why it causes symptoms, and how we can put it together with biomechanics and acupuncture infusions. He's the third of the musketeers. So Shelby's one, I'm one, and Dr. Nelson's one. And now we get to bring him in the studio. That's where you're talking about next week on the America's Healer program. So grateful for our sponsors. If you have health questions, please, you can call in, you can email us, you can get more information on americashealer.com. This is Dr. Jason West and Shelby Stoddard, nurse practitioner, wanting to sign off, and we'll see you guys around. And remember, you're not your diagnosis.
Thanks for tuning in to today's episode. America's healer, Dr. Jason West, will be back next week to share more of his expertise, so don't miss it. Until then, have a great week.